Hi Roger, my name is Kristen and I'm a physical therapist, and from the brief history that we got from you, it definitely sounds like your sciatic nerve is flared up, and there's a few things we need to address initially, and the first is to get the pressure off of the nerve. If the nerve is, whether it's being pinched at the back or in the buttocks region, that can often cause pain down the entire leg, which it sounds like you have had at times. For you to say your pain range has been a 2 to an 8, it has gotten quite severe. So the first thing we want to do is control the inflammation that happens around the nerve. And the first way I want you to do is positioning. You've done right by getting up and off the nerve. Walking around, you say, is better, and that's because you're taking the pressure off. So a lot of times direct pressure, like we do in sitting, on that nerve is causing the irritation around the nerve, which is actually an inflammatory process that occurs around that nerve. When the inflammatory process and that nerve irritation gets bad is when the pain goes all the way down the leg. So what I want you to do is position yourself in a comfortable position, and that comfortable position often is sideline. So I'm going to guess that that is sideline, and this is something we can follow up with you if this would help you. So the first position I'm going to have you do is you're going to lie on your side with your left side up, since that is the painful side. And often you can get most comfortable with a pillow between your knees in sideline. Then in this position, I want you to put an ice pack over the pain area, and it sounds like it's your lateral thigh and can go down to your knees. So what I want you to do is put an ice pack over the most painful spot and to lie in this position, as long as you can get relatively pain-free, to lie in this position for 15 minutes, 2 to 3 times a day. Once we can get the pain level down and the inflammation down, that's when we can begin to start exercising it. So there's 3 exercises I'm going to also have you do, but they all need to be performed relatively pain-free. So it doesn't matter when you do the ice. If you only have time to ice in the evenings, ice 2 or 3 times with an hour in between. So if you ice from 6 to 6:15, wait an hour, ice again from 7:15 to 7:30, wait another hour, ice again at 8:30. Then twice a day I'd like you to do these exercises. The first exercise is bringing one knee towards your chest. You're going to just hold that stretch for about 15 seconds. And I want you to do it on both sides. So you're going to hold your knee in towards your chest, hold it for 15 seconds, and then switch to the other side. You should never feel more pain in this position. It should always be a position that you get some sort of pain relief. If there is more pain, we'll have to reassess, and I don't want you to be doing these exercises through pain. They all should give you pain relief. So you're going to hold it for 15 seconds and do 3 on each leg. And then alternate and hold it in. And once you've completed 3, I'm going to have you bring both knees to your chest at the same time. You're going to grab your knee and pull it in. Sometimes you're more comfortable if you put your hands behind your knees here, and you're going to hold that for 15 seconds. You mentioned in your email that you were overweight. If this becomes uncomfortable, what you can do is use a strap or a belt behind your knees so you can hold it here, because sometimes the pressure becomes uncomfortable. Hold it for 15 seconds and repeat this 3 times, pulling your knees in towards your chest. The last exercise is actually a nerve glide to put tension on the sciatic nerve, but I don't want you to irritate the sciatic nerve, so you're going to perform this with both knees bent initially, and you're going to straighten your leg up, and if you feel pain, if that reproduces your pain, you're going to pump your knee into the pain and out of the pain, into the pain and out of the pain, and into the pain and out of the pain. And again, if it's difficult for you to hold behind your knee, I want you to use a belt or a strap behind your knee, and you can hold it here. And you may not be able to straighten your leg all the way out. Your range of motion may be this, but I want you to go to into the pain, out of the pain, into the pain, out of the pain. It's important that you don't stretch too far into the pain and hold it there, because that will cause more irritation on that nerve. So again, you're going to go into the pain, out of the pain, into the pain, out of the pain, and you're going to repeat that 10 times. Then you're going to switch and do the same thing on the other leg. The other leg probably will not hurt. It probably won't be painful. You'll just feel a stretch. So for the stretch, you just want to go into the stretch and out of the stretch, into the stretch and out of the stretch, and pump that 10 times. So those are your 3 exercises and the instructions I want you to use to really get that irritation around the sciatic nerve down. Please feel free to contact us again if you have any other questions. I'd be anxious to see how this works for you. Be well.